Good morning. I am Dr. L. Venkatakrishnan, Chief Gastroenterologist and Hepatologist from PSG Institute of Medical Sciences and Hospital. Every year, 28th July, we commemorate as a World Hepatitis Day. Why? Because hepatitis forms one of the biggest burden of liver disease in the world. We have lot of hepatitis like hepatitis A, B, C, E and D, and over the years hepatitis B and hepatitis C caused a great burden of liver disease, which resulted in lot of patients having chronic liver disease, liver failure, liver cancer and death due to liver disease. In India itself, our prevalence of hepatitis B virus is about 3.5% to anywhere between 2.8% recently in our population, and hepatitis C is about 1%. Both these viruses can cause enormous damage to the liver in the population and thereby cause lot of economic loss, then impact on the family and also loss of productivity, and ultimately because of the disease there are a lot of deaths happening. So what is our aim on the World Hepatitis Day? Number one, the first thing is we should always prevent hepatitis. So to prevent hepatitis A and E, common safe practices like clean drinking water, clean food will help us. For hepatitis B, the only single most theme we should have is to vaccinate everybody for hepatitis B. These days, children do get vaccinated for hepatitis B at birth, but nowadays it is our responsibility to vaccinate everybody against hepatitis B, so that the infections due to hepatitis B still comes down. We are still not able to conquer hepatitis B because treating hepatitis B is a very difficult proposition. So it's important that we carefully look for all patients who have got hepatitis B, treat them early so that you prevent liver cell failure, complications of liver disease and ultimately liver cancer and death. We are able to now at least control hepatitis C because of excellent drugs which have come into our armamentarium. Now the WHO is looking at 2030 to eliminate hepatitis C. But to prevent hepatitis C, we should have safe practices like safe blood transfusion, safe infection, safe surgery, safe dental extractions, and we should be very safe so that we bring down the transmission of hepatitis C. It is also important that we recognize hepatitis B and hepatitis C in the pregnant mothers and take adequate steps so that they do not transmit hepatitis B and C from mother to child. So on this hepatitis B, I think all the health workers should take a pledge, two things, to considerably reduce hepatitis B transmission. Number one, educate people about hepatitis B, encourage vaccine for hepatitis B so that we can probably bring down the disease burden of hepatitis B. For hepatitis C, it is important that we always have safe practices. We should quickly identify hepatitis C infections, and because of good drugs available, we are able to cure hepatitis C to an extent, and we hope to cure hepatitis C by 2030. So it is important that in our Asian countries, hepatitis A and E are also a major burden, and it is important that public has to be educated about clean, hygienic practices every day, to either in washing their hands or keeping their food clean, keeping their environment clean, keeping their drainages clean, so that we don't get these infections. So we should be able to eliminate hepatitis C and considerably do safe practices so that we do not get hepatitis in the population. Thank you.